Good morning. The ACT has experienced the toughest day of our pandemic response so far. 2 Canberrans with the virus have passed away overnight. They were residents of the Calvary Hayden Residential Aged Care Facility, receiving end-of-life care from the palliative care team. They were both aged in their 80s. I speak for the entire ACT community in sending our condolences and our love to the family and friends of these 2 Canberrans who have sadly lost their lives to the virus. The ACT has also recorded the highest number of daily cases since the pandemic began, with 52 new cases to 8 p.m. last night. 40 of the 52 cases are linked and 12 remain under investigation. More than half of today's new cases are household contacts. 17 were in quarantine during their entire infectious period, but at least 31 were infectious in the community. We have 11 people currently hospitalised and 3 in intensive care, all requiring ventilation. So today's increase in case numbers will come as a shock to many, but it's an important reminder that the virus is still very much active in our community. Every time you leave your home and interact with other people, there is a risk that you may contract the virus. And then what happens is you bring the virus back home with you and infect those you live with. Now, when we get to higher vaccination rates and we start to further reduce our public health safety measures, daily case numbers like this will become the norm. We are not at that point yet. 40% of our community who are eligible for a vaccine are not yet fully vaccinated. And these are predominantly Canberrans under 40 years of age. Now, we have 2 weeks to go until the planned end of our lockdown, when we will reach what I hope will be nation-leading high vaccination rates. So in the next 2 weeks, which will be the toughest 2 weeks that we have experienced, we ask Canberrans to keep doing the right thing. You can't let your guard down now. We've come this far. We can't let this get out of control in the next 2 weeks. Please listen to the health advice so that we can end this lockdown as safely as possible. Now, one part of this is to continue to get tested. If you have any symptoms, come forward for testing. And 3,875 people came forward for testing yesterday. But with today's record caseload, we have several new exposure sites listed on the COVID-19 website. So please ensure that you are getting tested as soon as you can and that you isolate whilst you're waiting for your test result. Now, on the vaccination front, the ACT has become the first Australian jurisdiction to reach 90% of our population 12 years and over with the first dose of a vaccine. That is a tremendous achievement for this community. 329,312 Canberrans had had a first dose of a vaccine up to close of business last night. What this means is that by the end of this month of October, we can expect over 90% of the Territory's eligible population to be fully vaccinated. This provides a very good level of protection from the virus in the ACT. But we're not there yet, and we won't be until the end of this month, which is why the next 2 weeks and the 2 weeks after that are critical for this community. Currently, our fully vaccinated coverage of the eligible population is just a little over 62%. So between now and when the lockdown is scheduled to end, we need to deliver tens of thousands of second doses so that we can reach the 80% milestone before the lockdown ends in the middle of October. There are still Canberrans who are yet to even get a first dose of a vaccine. So we are urging anyone who is waiting for their first dose to make it a priority. Make it a priority today, over the long weekend, or early next week. Now, we've been contacting people who have bookings in our system later in October and some into the first part of November. 5,127 appointments have been able to be brought forward in the last 2 days, but we need more appointments brought forward. There are Pfizer bookings available in ACT government clinics as early as this Sunday, and there are thousands of bookings that we can fill in the next few weeks. So please put your name against one of those bookings. If you've been putting off having a vaccination, please take the time now to talk to a trusted healthcare provider so that they can offer you advice on the best vaccine for you. We do this, we make this call for people to get vaccinated for a very simple reason. For every 1,000 Canberrans that we vaccinate, we can prevent around 100 hospitalisations. That's why this is so important. Turning now to National Cabinet and business and economic support. Next week's ACT budget will contain significant investments to support our economic recovery and to support more jobs in our city. The government will be using our budget to pump hundreds of millions of dollars into the ACT economy to support the strongest possible economic rebound. We've now paid out over $475 million in business support since the start of the pandemic, and this includes the ACT's 50% share of the joint funding packages with the Commonwealth. And today, the Minister for Business, Tara Chain, and I released details of a key industries package which builds on this business support program to increase economic growth and to create more jobs as we recover from the pandemic. Additional funding will be provided to help the recovery of our tourism, arts and events sectors. Additional funding will also support new business development, innovation, Canberra's exporters and our city's creative industries. There'll be more details in the ACT budget next Wednesday. National Cabinet is meeting this afternoon. The agenda is significant. It includes the vaccination rollout, Indigenous and disability vaccination plans, booster and third dose vaccination policy, public health system capacity, new Doherty Institute modelling, future approaches to test, trace, isolate and quarantine policy, future home quarantine policy, authenticated vaccination record policy, international travel for vaccinated Australians, aged care visitation policy, mandatory vaccination for healthcare worker policy, the role of ventilation in indoor spaces in reducing the risk of transmission, the reopening of schools, mental health support in our community, and economic and business support. This is a broad and far-reaching national agenda that the ACT continues to contribute to. I have no doubt, though, given the breadth of the issues to be discussed today, that many of these policy decisions will require consideration over multiple meetings. I'll report back to the community tomorrow at this press conference on any decisions that are made out of this afternoon's National Cabinet meeting. So in summary, for those who have joined late, sad news. 2 Canberrans who were positive COVID-19 patients have passed away overnight. And again, I extend our thoughts and our love to the family and friends of those Canberrans. 52 new cases, a number we didn't want to see, a record daily caseload for the ACT. But 40 of these 52 were linked, so we know where the virus is transmitting. 17 in quarantine during their entire infectious period, and at least 31 infectious in the community. And 11 currently in hospital, 3 in intensive care. This is a difficult and challenging day for Canberra. And I know everyone's thoughts will be with those who have contracted the virus and those who need hospital and intensive care. I'll now invite Dr. Coleman to provide an update on the overnight cases and the epidemiology, what we're seeing at this stage of our outbreak. And then myself, Dr. Coleman, Minister Stephen Smith and Commissioner Ray Johnston from the AMC will be available to take questions. Thank you.
Good morning, everyone, and thank you very much, Chief Minister. So, today's numbers, just to repeat, we have 52 new COVID-19 cases that have been notified since our last update. This brings our total cases for our outbreak this year to 887 cases, with 612 of those having recovered. We are currently managing 275 active cases. I would also like to extend my condolences to the family and loved ones of the 2 people that have passed away overnight. So just to confirm a couple of points about the new cases today, of the total 52, 40 can be linked to known cases or ongoing clusters, with the remaining 12 still under investigation. And of the 40 that we know are linked, this is actually 27 of those are household contacts. Of the 52, 17 were in quarantine during their whole infectious period, and of the remaining 35, 31 did spend some time in the community for at least part of their infectious period, while 4 remain under investigation. As at 8 p.m. last night, we have had 11 people in our hospitals. Of these 11, our youngest patient is in their 20s, with the oldest in their 80s. 3 of these 11 are in ICU, all requiring ventilation, aged between 30s to 60s. Of the 11, 7 are unvaccinated, 3 have had 1 dose, and 1 is fully vaccinated. So in today's numbers, we have another case linked to the Alexander McConaughey Centre. This is a staff member, and we know that they were fully vaccinated. ACT Health has been working really closely with ACT Corrective Services to contact all of the affected staff on the way forward. To protect the health and safety of staff and detainees, the centre has been placed in lockdown as per their outbreak management plan. We've talked about these plans before, and that is what they're designed to do. They are in place to manage cases of COVID-19 in high-risk settings such as this. And we have used these previously to support positive cases, and we are confident that they will be effective again. We continue to have 3 active public sites of transmission. In today's numbers, there are another 2 cases linked to the Calvary Hayden Aged Care Facility, bringing the total to 19 linked to that site. Furthermore, 9 new cases have been added to the London Circuit construction site, bringing the total there to 26. It's important to note that 8 of those 9 cases are household contacts, going to the Chief's point around still a significant proportion of our transmission is occurring within households, and goes to the importance of household members where there is a case continuing to quarantine strongly. But as I do plead with you every day, please continue to check the website to check on these exposure locations. And if you have been to any of these locations at the dates and times specified, please get tested and follow the directions. So I know that today's case numbers will be concerning for some people, given this is the highest daily number in the outbreak so far. And I must admit, it is a little concerning for us as well. But as we have said previously, a couple of high and low numbers don't make a trend, and our daily case numbers have been going up and down within a reasonable bracket. But I think what today's numbers do is reminds us that we can't be complacent at this point in our journey. We do expect that when we increase people moving around the community, as we are doing when we gradually lift our restrictions, there will be an increase in our cases. But we need this increase to be controlled. So please remember, we are still in lockdown and it is working, and we need to continue to let it do its job. Without our current social measures, I am confident that we would be looking at a figure that is much higher than 52. We have seen the exponential increase in cases in other jurisdictions and in other countries where there were minimum public health social measures in place. And this is why, in our pathway forward, we've been really careful to ease the restrictions gradually and in a phased way. This gives us time to monitor the impact of each set of changes and make adjustments if necessary, while we continue to strive for that really big vaccination coverage. I know that everyone is looking forward to spending more time with friends and family this long weekend, myself included, but I do urge you to please follow the health directions. They are there for a reason and they've been working well. Now is not the time to look for loopholes or attend large social gatherings. We still need people to limit the interactions they have wherever possible, while we continue to walk towards our vaccination goals. We have these in sight now, and the Chief just spoke to those over the next month, what we're hoping to achieve. So let's hang in there and see if we can continue to keep limiting that transmission. So as well as today being the first day of Mental Health Month, and I know that Dr. Elizabeth Moore came and spoke to this yesterday, it's also International Coffee Day. And let me tell you, coffee is really important, particularly during lockdown and as we come out of restrictions. So I do just want to thank all the baristas and service staff across the ACT that have been continuing to serve takeaway coffee, not just on behalf of the essential workforce, but everyone else who is also in lockdown and probably have the need for that fix every now and again. I'll hand back to Chief for questions. Thank you.
Thank you, Dr. Coleman. Questions?
Chief Minister, when Victoria recorded its large spike in cases over the last 48 hours, the Premier pointed to too many people making household visits that they shouldn't have. Is that what's happened here in the ACT? What are case interviews telling authorities about what's occurred?
Sure. Look, Dr. Coleman will be able to give a little bit more detail on the specifics, but I understand that it's more linked to a series of clusters associated with essential workplaces, for example, construction, childcare, those sorts of activities where people have been at work for a legitimate reason. Look, I don't know how many AFL Grand Final parties there were in Canberra. There's not a huge evidence to suggest that there were a lot of them or that they were super spreading events. My word of caution ahead of the NRL Grand Final this weekend is that although the public health directions allow for 2 people to visit a home, at the point of that is very small gatherings, not an NRL Grand Final party where you have 15 people over. That's almost guaranteed to be a super spreading event. So, look, it is anticipated, as Dr. Coleman said, that when each time we ease restrictions, you're going to see an increased level of risk and a transmission potential that that increases slightly. What we are very conscious of, and I made this point in my opening remarks, is that this next 2-week period where I know people are desperate to get to that 15 October date, we are not yet vaccinated enough. But the signs on the vaccination front are incredibly encouraging. Once you've got a first dose, you're coming back for a second. That the evidence is there to support that. So this city will get over 90% fully vaccinated. But there's a dosing interval. It takes, once you've had your first dose, you've got to wait 3 or 4 weeks for your second. You've got to give that time. And that's why the next 2 weeks and then the 2 weeks after that are really, really critical for what November and December are going to look like. And when we get to the point that we can further ease restrictions, we'd much rather do that, and we would be much more comfortable doing that in a lower caseload environment.
You said yesterday that cases in their 30s wouldn't be enough to affect the schedule. Cases in their 50s or beyond, how will that impact the schedule going forward?
Well, again, as Dr. Coleman indicated, one day is not a trend. We'll need to see what tomorrow's numbers show and what we see over the weekend. It is anticipated, as both myself and Dr. Coleman have said, that there will be an increased number of cases. But what we're endeavouring to do is suppress case numbers until we get to the point that we have more than 90% of the community vaccinated. But the evidence is pretty clear now that the virus will go wherever the vaccines aren't. And so even at 90% of the 12 plus population fully vaccinated, that still means you're going to have about 35,000 adults who are not vaccinated and about 70,000 children under the age of 12 who are not vaccinated. It's 100,000 potential virus hosts. So it's still a big number out of 435,000 people.
Depending on what happens over the coming days, can you rule out tightening restrictions back up again?
I don't want to rule anything in or out based on one day's numbers. They're not good, they're not where we want them to be, but one day isn't a trend.
Do you think that Canberrans will be able to travel overseas before the end of the year? And did you receive any briefing on the plan to reopen international travel before the National Cabinet meeting?
Look, yes, I do think that Canberrans will be able to travel overseas if they're fully vaccinated. Where they'll be able to travel could be very limited and would depend on again, decisions that the Australian government will make around what might be considered green zone countries. But I think it would be fair to presume that international travel will not be completely open to go anywhere in the world. I saw the agenda, as in that the item would be listed to be discussed at National Cabinet, and it's not a surprise that we would be discussing international travel. It is principally a decision for the Commonwealth Government. In terms of the detail of the papers, no, the standard practice for National Cabinet is that papers drop, late the night before or on the day of the meeting, giving participants in National Cabinet almost no opportunity to even read them before walking into the room. It's one of the worst aspects of National Cabinet and the way the Commonwealth approach dealing with the states and territories. I mean, it's pretty disgraceful to dump papers, particularly, for example, the one on health system capacity, which is more than 100 pages long, has arrived less than 24 hours before the meeting. It's very disrespectful of National Cabinet members, and what it means then is that decisions have to be taken over multiple meetings because we just haven't even had the opportunity to read the material. So National Cabinet's got its strengths and its weaknesses. One of the weaknesses is the way the Commonwealth treats the states and territories in dumping papers at the very last minute. It is just so disrespectful of the process.
Chief Minister. Minister, given it's the last weekend of the school holidays, you imagine attention might turn again to the return to school that's set to happen in the next few weeks. Will we start to see things like schools being assessed for ventilation, and will the results of those sorts of assessments be made available to parents and school communities?
Sure. So obviously we did a lot of work on ventilation issues post bushfires. ACT schools vary in their age and in the nature of their ventilation systems. So there will be, of course, a spectrum of ventilated spaces within even an individual school setting. So in the context of COVID-safe return to education, those factors will be taken into account at a system level as well as at an individual school level. So that even within an older school, a school that's 100 years old, it's like some of the inner Canberra schools, there will be some spaces within that school that would have better ventilation than others. Now we note that, of course, there's a staggered return to school. We're coming into the time of year where the weather is a little bit more favourable to activity outdoors. Now, all of those sorts of common sense considerations will be taken into account at an individual school level. Parents who may be concerned about ventilation issues within individual schools can certainly get access to information at a school level. But I don't envisage us publishing a matrix of every single school in the ACT, every single teaching space, but it would be managed at a school level.
Chief, you've spoken about plan to suppress cases until we hit the 90%. What do you see that meaning in terms of opening borders for other states? How closely will you be watching how soon they too hit that 90%?
Sure. So I think we can be absolutely certain that there's no change to travel arrangements between now and 15 October. Between 15 October and 29 October, so that period where we are out of lockdown, and New South Wales will also presumably come out of lockdown in most areas, although we don't know whether they'll still continue with targeted local government area lockdowns if they have cases, particularly in the regions, that you would see, at least for our region, a discussion that we hope to conclude that would enable the postcodes in the immediately surrounding areas of the ACT that we've been operating for a while now to have an expansion of the number of postcodes there. So it's yet to be finalised exactly what's in and out of that. New South Wales have a requirement that they've publicly announced that until the 1st of December, only vaccinated people can travel to New South Wales regions. So between 15 October and 29 October, I would anticipate that vaccinated people could move across the border into New South Wales into an identified area of postcodes, and we would seek to work with New South Wales to have that be a reciprocal arrangement. Beyond 29 October, the trigger there largely being New South Wales crossing over certain vaccination thresholds and the ACT crossing over certain vaccination thresholds. At that point, consideration will be given to further travel into more regions of New South Wales. Again, only for vaccinated people, because New South Wales will not allow unvaccinated people to travel into the regions. And that would apply, it would seem, from about the 29th of October through until the 1st of December. The thing I can say with great certainty is that, based on what New South Wales have said, is that after 1 December, they'll drop their distinction between vaccinated and unvaccinated people in terms of travel within New South Wales, and that the ACT would by that point have vaccinated everyone who wants to get vaccinated. And so travel will be a lot freer after 1 December. So there's a degree of uncertainty between 15 October and 1 December. The only thing I can say certainly about that is if you're not vaccinated, you're not travelling into New South Wales. That's their rules. And equally, we would not be having New South Wales people, unvaccinated people, travelling into the ACT.
So travel will be freer, but you won't be waiting for New South Wales or Victoria to hit 90% like we will be hitting?
New South Wales are basically running at about the same pace as us. will cross over 80% roughly around the same time. So the point I made yesterday when these sorts of questions came up is that it's more likely that we'll be able to have New South Wales ACT agreed travel arrangements. Victoria is running about 10 percentage points behind New South Wales and the ACT on their first and second dose rates. So travel to Victoria might take a little bit longer, maybe two weeks behind the ACT New South Wales, maybe 2 to 3 weeks, depending on their vax rates. And then beyond ACT, New South Wales and Victoria, we can really only go on the public statements of the premiers of the other states. Tasmania, for example, a Liberal government in Tasmania has talked about not opening their state's borders until they have reached 90% vaccination internally. Now, I'm sorry, I've missed most of the media bombardment of the Tasmanian government about not opening its borders until 90%. I see Anastasia and Mark McGowan, Anastasia Palaszczuk and Mark McGowan are the focus of a lot of attention from certain media outlets. I don't see many questions being asked about Tasmania or indeed what the position of South Australia is. Maybe I might have just prompted a few more questions of my South Australian and Tasmanian colleagues.
Chief Minister, there's still much to be considered, we understand, but what is your thinking on international travel, opening up to that? Will you allow people to quarantine from home from next month?
So home quarantine is a discussion item at today's National Cabinet meeting. I'm not certain that it will be concluded today, but I presume it would be at either the 15th of October National Cabinet meeting or the 29th of October National Cabinet meeting. We'll obviously get a date from the Australian government on when they would intend to open Australia's borders and who they would intend to open it to in terms of other countries and what requirements the Australian government will place on travel, noting, of course, that you may also have to meet the vaccination and other health status requirements of the country that you want to travel to. Now, I don't think there's going to be any direct international flights into the ACT this year and possibly not even next year. So what we will need to negotiate is an arrangement with New South Wales, Victoria and presumably also Queensland and potentially South Australia and WA, who would all at some point over the next 12 months start taking international flights. So it would just be a question of, well, what will the transit arrangements be? You'll come in from overseas and land in Sydney or Melbourne or Brisbane or Adelaide or Perth. What are the requirements on you then to either quarantine in that city where you arrive, or will you be able to transit home? That'll partly be determined by what the Australian government requires and then also what that state government requires of you. My hope, though, is that we'd be able to negotiate an arrangement where you could transit from that airport into the ACT.
Is the ACT looking at changing the contact tracing and quarantine requirements to differentiate between like vaccinated and unvaccinated people, so perhaps a venue wouldn't have to close entirely if there was an exposure, or vaccinated people wouldn't have to do the full 14 days quarantine?
Sure. So this issue is again part of National Cabinet's considerations. We'll take advice from the AHPPC and from Dr. Coleman in relation to our local context. So I don't have an announcement on that yet, but I can advise, obviously we are looking at that and the implications. Again, I think it's a very different scenario later in the year than it is on the 15th of October. So I wouldn't be anticipating radical change on the 15th of October, but by 1 December and beyond, we may well have transitioned into a different model. But there's still a lot of policy work, a lot of expert advice to receive, absorb, and then make a decision. But what is occurring, obviously, is that this is a situation that every jurisdiction is going to experience, and so we're having a discussion at National Cabinet level.
Thank you, Chief Minister. Some questions for the Chief Health Officer, if we can.
Okay. Thank you.
Doctor, are we able to confirm the cause of the outbreak at the Calvary Hayden Aged Care Facility at this point? Do you know where it's come from?
No, look, I haven't been briefed on that yet, and those investigations are ongoing.
What's happening when it comes to these clusters that we're seeing, these high case numbers today? The Chief Minister's just saying he doesn't think it's grand final parties. What do you think's happened?
Look, I think what we're seeing probably is a little bit of a fatigue with our public health restrictions, but also some of this transmission is associated with perfectly legal and okay activities. So I think this is just part of our progression and why it's been so very difficult to get down to zero again with Delta, and I don't think that we've actually seen any jurisdiction do that successfully. Our really big aim is to keep those numbers as low as possible until we open up, until we have a vaccination coverage level that's really high so that we can limit the nasty health outcomes moving forward.
Is there any issue with, essential workplaces complying with COVID safety measures, especially in construction and the exposure sites that we're seeing?
Look, I think that every workplace probably has a circumstance where there wasn't 100% compliance. I know that some of the really hard places to do that are in the shared staffing areas. So I think it's really hard to remember to wear your mask when you're sitting in the lunchroom, in the tea room, and physical distancing and those kinds of things. I don't have privy to all the information on compliance, but I haven't actually had any really serious reports that we've needed to really do something about. I actually think construction have really embraced the COVID safety plans that we've spent a lot of time with them on. And I think that just goes to, in this current construction outbreak, we really only have seen transmission at that first site. So really only at that first site where that person was on site are known to be infectious. And what we've seen from that is household contacts. So I think that's just actually a really positive in terms of how we're learning as a community and as industry is learning to manage COVID transmission.
Dr. Coleman, the positive case at the prison, do you expect more cases to come from that cluster? Or?
Oh, look, I would never say no. I'm really confident that we have got that reasonably early. We have fantastic plans in place, and we will now move very quickly to isolate all the close contacts and actually work on our casual contacts as well. There will be testing conducted today, so if there's already been transmission, we will pick that up very quickly. There may be a couple of cases on the basis of that, but I'm confident that we can limit that.
And do you have data about the vaccination rates of inmates and staff at the prison?
Oh, look, I don't have that with me, but we do have Commissioner Ray Johnson who can talk a little bit more about that if needed.
Dr. Coleman, quite a few Canberrans will probably be fearful about what the 52 cases might mean for restrictions which have changed from this morning. Was there any, where did that play in your consideration, or was it that, you didn't think one bad day of cases isn't going to be a big impact?
I think what's really important in the next couple of days is to have a look and see whether this is just part of our up and down, and whether our up and down is trending very slowly up, or whether this is an early indicator of something a little bit more happening. All of that will play into next week's discussions. My aim is to leave the settings as we have announced moving forward. That would be ultimately what I want to achieve. I think we've put together a really nice pathway forward, which has a really nice risk, a balance of risks as well as opening up moving forward. I know that not everybody is completely happy with it, but we've talked about cumulative risk before. So that's my aim, and it would have to be quite a significant increase in risk to make any significant changes to that. Keep getting vaccinated, everyone. That's what's going to get us out of this.
Some questions for the Health Minister if my colleagues are finished with the Doctor.
Thanks, everyone.
Thank you, Doctor. Minister, is the 2-week time for the vaccine to become effective, is that still being considered when it comes to these timelines for lifting of restrictions, particularly that 15th of October date?
Yeah, look, I think what we are really, and I think Dr. Coleman just said in terms of the pathway forward out of restrictions, we're looking at that 2 weeks from today to the 15th of October when lockdown ends, but then another 2-week period to the 29th of October when we'll start to see those restrictions ease further. So by the time we get to the 15th of October, we do expect that in our community, over 12-year-olds and older will be 80% double dosed, but as you point out, that doesn't necessarily mean to say that 80% of the population will have a fully effective vaccination. So that extra 2 weeks not only enables us to get to a higher level of double dosed in the community, but also enables us to get to a higher level of effective vaccination for that 80% of the community. So that is exactly one of the things that has been considered, among many things, in designing the gradual easing of restrictions and the pathway forward.
On the Western Access Sensory Friendly Clinic, many people in the autistic community are saying that it's unsuitable for their needs. They are calling for the government to do more on that. They're saying it's simply ticking a box for autistic people and then moving on. Does more need to be done at that facility to make it accessible for people with autism?
Well, I'm always happy to take feedback, but I actually just saw an article the other day on LinkedIn from an autistic Canberran who was praising the facility and saying it exactly met their needs, that the staff there completely understood, both the people who spoke to that individual on the phone and took their booking, went through all of their needs very closely. When they arrived at the facility, the staff there were very sensitive and understanding about their particular needs. They particularly praised the natural light and the capacity to be in a quiet space, both during having the vaccination and during recovery. So if other people have had a different experience, we will always take that on board. But the experience that has been conveyed publicly through that article on LinkedIn and the experience that's been provided to me by other people in the disability community has been a really positive one about that Western Creek facility. So what I would say is just to please be really cautious about putting people off going and getting vaccinated. It is absolutely vital that people with disability in our community feel confident to come forward and get vaccinated. So we will always take on board feedback and our staff will work really hard to continue to make Western Creek an accessible and an appropriate location for people with autism in our community. We will absolutely take on that feedback, but I want to assure anybody with disability in the community, and particularly people with autism, that our staff will work very hard to make sure that it is an appropriate location for you to come and get vaccinated. So I don't want anybody to be put off by one person's potentially experience that may not have gone as well as expected, because lots of other people have provided very, very strong positive feedback about their experiences previously at Kerryn and now at Western Creek.
Were people from that community consulted on the setup of that facility?
Yes, the disability community was consulted and we learnt a lot of lessons around what we needed to do from the experience at Kerryn as well. So I can't say exactly that people with autism were specifically consulted about the Western Creek facility as it was being set up. You'll recall that while it was being set up, it was a testing centre, so people weren't walked through the facility, but the Disability Reference Group and others who have been involved in our response for people with disability involved in the Access and Sensory Clinic establishment at Kerryn were also involved and engaged in the establishment at Western Creek. And so we will absolutely take feedback from people, but we also absolutely need to continue to encourage people with disability to come forward and get vaccinated.
Will any more resources be put into processing travel exemptions for people to come into the ACT for essential purposes?
So I think you're probably referring to the article that was in the Canberra Times today and that I was asked questions about yesterday, and I have now been briefed on that particular matter. That was not a question of resourcing. That was a question of a miscommunication about the information that needed to be provided, and the information that was required was therefore not provided in time for that application for an exemption to be granted. So it wasn't a resourcing issue, it wasn't a workforce issue, it wasn't an ineffectiveness of the exemptions team. It was a miscommunication. That individual has had a call from the exemptions team. They have apologised for the error that was made in that particular case. But I do want to again make the point that the exemptions team works through hundreds, literally hundreds of exemption applications every single day. They have done tens of thousands of exemption applications over this period of time. The only time we ever hear about it is when something goes wrong. That is very unusual. And again, the rest of the feedback that we get about the exemptions team is how professional, how polite, how efficient they are. They're under enormous pressure. Often exemptions do come through quite late in the process. People are advised that that is likely to happen through an automated email that they get when they submit their exemption. They are advised that it may not come through until quite close to the time that they need it. But the exemptions team works with people who are often in really complex and emotionally challenging circumstances. And as I said yesterday, over the last week, they've really worked very hard to get through a backlog of exemptions applications. So no, it's not a matter of workforce. It's a matter of just being, it was just a matter of miscommunication in this one particular case. I don't think it speaks to a systemic issue at all.
Minister, can you confirm reports of a building in Braddon being locked down as a result of COVID cases?
I can't. I'm sorry, I haven't been briefed on that.
I've no further questions for you, Minister. Can we speak with the Commissioner, please?
Yep.
Thank you.
Hello all. Questions?
Are you able to say this worker, this person from the jail who's tested positive, what areas of the jail do they work in, and what steps are being taken to mitigate any risk?
So I think, as you've already heard, we have a staff member that tested positive yesterday. We understood when we got the results yesterday. The centre was put into lockdown as part of our normal protocols to deal with that case. The staff member has access to a number of places in the facility, and we're working closely with Health now to go through and make sure we've identified all the places in the facility that she may have been. The particular period of time we're looking at with Health goes back for Monday and Tuesday particularly. So that period of time we're working through, and we're working, I think, pretty much now got to all staff who may have been affected by that, and Health are working with them to take the next steps.
What measures are being taken to protect prisoners at the jail at this point?
So I think, as I've said before, we have protocols in place for new detainees coming onto the site in terms of isolation and testing prior to them being released to the general population. Staff wear, to the extent they can, depending on the duties, PPE, and certainly when they're dealing with detainees who may be of high risk, wearing full PPE. We've limited the movement of detainees around the site since lockdown started to prevent possible spread between detainees that way, and try to restrict staff to particular areas where we can, because we've got only a certain number of staff. So we work hard to make sure we don't have any cross-contamination, if that's the best way to put it, within the facility. So it's mostly around minimising movement of both staff and detainees to the best of our ability, while still giving them opportunity for exercise and light and food and all the things that they reasonably should expect.
Is there measures in place as well for testing or quarantine of detainees who are being released back into the community?
We're looking at that. Obviously, previously, without any cases of COVID in the facility, there was no value in testing going out. So at this point in time, anyone who's certainly had a vaccination or only half a vaccination in the AMC are going to be supported to get the part of their vaccination when they come out. And depending on the circumstances on their release, they'll be advised about getting tested if that's necessary at the time.
Space is at a premium within the jail at the best of times. If you have COVID-19 cases in there, that could be a real concern, couldn't it?
Well, indeed, and hence why we've got facilities now to manage quarantine for all incoming detainees. So they're kept separate from the rest of the population in the normal course of events for 5 days, tested on day 1, tested on day 5. Higher risk cases where they might already be a suspected close contact in the community or something else that tells us where they might be higher risk, that could be extended to 14 days. And obviously, as you're aware, we've had a number of cases that we know were positive when they were admitted into the AMC. And of course, they are dealt with the support of Health through the same quarantining process. And as you're aware, I think the first case we had was on the 11th of September, so we've been about 3 weeks since our first case.
Is this also about staff members' infection known at this time?
Look, I don't think I could go too much into the matters around the particular staff member. I could say, though, that the belief is that the infection occurred from the community, not from inside the AMC.
Are you able to confirm whether it's a senior member of staff at the AMC?
I suppose it depends on what you mean as senior, but reasonably senior, yes.
And do you have updated vaccination rates for inmates and staff, or not with you right now?
The latest detainee vaccination rates that I can recall was 63% 2-dose, 77% 1-dose, but I think that's now nearly a week old, so we should get an update soon. As I've said before, in terms of corrections officers or any staff from corrections, they've been given the opportunity for vaccinations and strongly encouraged to get vaccinated. My expectation is that we'd have a pretty good take-up of vaccinations, and I think, as you heard, the particular case, the staff members fully vaccinated, which I think helps us in a long way, because we got onto it quite quickly, and we hope that limits the spread of it. At this point, there's no mandatorily requirement for vaccinations for AMC staff.
And just lastly, you said before the 2 days of concern are Monday and Tuesday, so did the staff member work only 2 days whilst infectious?
Monday, Tuesday and Wednesday, sorry.
Okay.
Yeah.
So 3 days while infectious?
3 days. Well, that's a matter for health to determine when they think the person was infectious. So I think in the interest of caution, but I wouldn't want to say for sure. That would be a matter for health to say they were definitely infectious for that period of time. I think we're just working on the basis of caution.
Thanks, everyone.
Thank you.